All right, good afternoon, everyone. The Senate Finance Committee is in session for a voting session, and we'll ask everybody to pay attention so that we really hear the details of the bills and any amendments that might have been proposed as we consider each piece of legislation. Okay, which analyst is starting?
Okay. Senate Bill 9 deals with collective bargaining between the University of Maryland system and exclusive representatives. The bill does 6 things. I will run through those 6 things that the bill does. First, it alters the designation of supervisory, managerial, or confidential employees under the law. Under the current law, it is the Secretary of Budget and Management that designates supervisory, managerial, or confidential employees for regular state employees, for the purposes of whether they're included as in collective bargaining or not. And it's the governing board of the institution of higher education that designates these employees for higher ed collective bargaining. Instead, the bill would change this to the respective labor board. So it would be the State Labor Relations Board that would make this designation of who is a supervisor or manager or confidential employee, and it would be the Higher Education Labor Relations Board that would make this designation based on standards similar to National Labor Relation Board determinations. Secondly, the bill adds the Chancellor of University of Maryland System to all aspects of collective bargaining for provisions relating to the University System of Maryland institutions. The bill removes the authorization for the University System Maryland institutions to cooperate for collective bargaining purposes, which is under current law, because under the bill, the Chancellor will negotiate with exclusive representatives, sign memorandums of understanding, and take part in all collective bargaining negotiations between the university system and exclusive representatives. The bill authorizes consolidated bargaining amongst the exclusive representatives if they represent more than one bargaining unit with the Chancellor. And finally, the bill changes references under the University System of Maryland personnel for collective bargaining purposes only, from administrative personnel to represented and unrepresented employees.
Move favorable, Madam Chair.
Okay. Senator Battle, yes, yeah, okay. Is there any discussion on the motion? Senator?
Well, I just want to, I guess I'll ask the sponsor, because, some of us did get contacted about some movement or discussion or negotiation with Chair McIntosh and on the other side. I don't know if there's there, but since, it happened, Senator Kramer, I have to just put it out there just to know if you know anything about it, or is anybody aware of anything, concrete actually happening over in the House? I just have to ask the question before we...
I haven't heard anything from anybody.
I will share that the most recent conversation I had is that the House was looking for us to move on it and take action, and that's why I think we have an opportunity to be voting on the bill today to move it forward clean. There have been conversations going on at channels above me since the bill was heard on February 4th, 5 weeks ago. I think the understanding at this point is it's time to move the bill. The university system, I know, is doing a lot of fishing today, trying to see if they could get someone on the committee to do certain things. I heard from several of our colleagues that they were being contacted, trying to slow it down and delay it at this point. So I'm hoping we will finally, after 3 years, vote the bill. And as I said, the hearing was almost going on 6 weeks ago.
Okay, Senator Hershey, and then
I'll second the motion.
To do what? For me to talk?
Senator Hershey.
Thank you, Madam Chair. I received a number of messages as well today about the opportunity to at least hold this while the university system is is negotiating with AFSCME. They have mentioned, and a little bit contrary to what my colleague said, that they have been working for weeks on compromise amendments. And this was under the direction of Chair McIntosh in the House, that she, I guess to what my colleague says, I guess this is the year it's going to move. And as you know, we have not moved it in a number of years. So I think the direction was get on board, find a compromise, and that's what they're trying to do. So all I'm saying is it's just that they've asked to see if we could hold it while they're working out those amendments. I don't think it was malicious or anything, but I think they're under the guise that they have to get something done with a compromise this year, and that I guess the body is willing to move it this year.
Okay, Senator Reedy.
So I feel a little bit upset. Nobody called me, but I'm just reading the testimony. I'm just reading the testimony
You
from the
are not
university
alone.
system.
Nobody called me either.
Yeah. I think that you'd be more important to call than me. But in all seriousness, I'm just reading the testimony. I remember this hearing, and I mean the concern that's being raised by the university system. I got to understand why we're doing this, like how this will help with making sure we maintain an affordable system for people. We're all concerned about rising cost of going to college, and their rationale is not bad. I mean, it basically says you've got a lot of the smaller institutions band together because they sort of have a unique niche, whereas the University of Maryland, College Park, and some of the other larger institutions have their own unique needs. They're concerned that if you have to average everything together, you're either hurting one group against another, or you have the pressure to try to make everybody the University of Maryland as far as how they compensate staff. So, I mean, I remember the hearing was all about how it's all this confusing thing that has to be agreed upon, then go up to the chancellor, then come back. It seems to me that the process is pretty much the chancellor is going to do what the member institution has agreed to do in most cases. So I don't know necessarily why we need this bill or what the rush is. So that's my 2 cents.
Okay, Senator Benson.
Yes. Thank you, Madam Chair. The University of Maryland has had a history of not being very kind to its employees, and that is why I think that this bill is so important, because the employees have been trying to work with the University of Maryland on many issues, and in a number of cases they have been completely ignored. But you have these different bargaining units all over the place. And so I just think that this bill is just very sensible. And as a matter of fact, I think that they said it was going to save in the long run, the university system will save the money.
Okay.
Quickly, I mean, again, they have a bargaining unit now, so if they're not being treated right, that's an issue that their union, and they need to work out between the union and the university. But again, my bigger concern is making sure it's affordable for people to go to college at our universities. So I'm more concerned about that because people have a choice of where they can work. But, we're trying to make sure college is more affordable for all our folks. So they're saying it's going to save money. I have doubts that if it was going to save money, the university system wouldn't be for it. So that's, I'll just leave it with that.
Okay.
Madam Chair, we have a motion and a second.
Yes, Senator Bidle.
Thank you, Madam Chair. I'm a little mystified by Senator Reedy's comments because they already have collective bargaining. This isn't about collective bargaining or not collective. It's about going to
How
one
they
place
do
and
it.
doing it instead of this little college does it and this campus does it, and then they go back to Maryland and Maryland has to review it and maybe they don't honor it, and it's just back and forth all the time. It's probably going to save money because you're not going to be paying somebody to represent all the unions multiple times, but overall, it doesn't change that they're still being collective, they have collective bargaining. Thank you.
All right. I think we've heard enough. We've got a motion and a second. Are you ready to vote? Yeah.
This requires the chancellor to do all of the bargaining for, is that what it was? As Pam Senator Bidle just mentioned, what the bill actually does, it requires the
Let me ask
chancellor to.
ask Patrick. I think he'll give us
Right.
the
Okay, I'm
clearest
sorry.
explanation of in the stance where the bill is, what it does.
Right, thank you.
Okay, Patrick, no. Under current law, there's 3 bargaining units at each college, each university system, exempt, non-exempt, and sworn police officers. Under the current law, they negotiate with the president of the system of the particular institution. So however many institutions there are, that's how many each has 3 bargaining units, and they negotiate with the president. What this bill would do would consolidate that and say that on behalf of each system institution, the chancellor would do all the negotiating with the 3 bargaining units at that institution. And it also authorizes the bargaining units to combine if they're all represented by the same union. So if, I'll use AFSCME because they always come up, if they represent 7 bargaining units, they can negotiate with the chancellor on those 7 bargaining units located across the system institutions.
So the negotiation goes on with the chancellor himself?
No, the chancellor or chancellor's designee. I mean, it's just I don't think the president was actually negotiating either. It's their designee or whoever they want to negotiate on their behalf.
Okay.
The governor doesn't necessarily negotiate with folks. It's designated folks in DBM.
But in this case, the USM or UMS actually said that they did not want that responsibility.
The USM is opposed to the bill that would consolidate bargaining, as in the testimony submitted to you with the bill as is.
Okay. All right. Thank you.
Let me ask you, David, isn't it the case that right now they start out at the local level and then it goes, so they do bargaining and then it doesn't matter because that's not the final word, then it goes up to the system level?
Testimony from the testimony on the bill for the proponents was that ultimately the presidents have to, they send it up to whatever they negotiate goes up to goes up to the board and the chancellor, and they either say yes or no. And so the final say on this, according to the testimony on the bill, is that the final decision rests with the chancellor.
So this would definitely save a lot of man hours and probably a lot of money that's paid to have the union representatives to go up the line and back down the line. All right, well, Senator Hayes.
Thank you, Madam Chair. And I almost forgot my light was on, but you just articulated just what I have heard the problem to be.
Okay.
They think that they're bargaining on a local level in good faith. They think they come to a deal, has to go all the way up to the chancellor's office. And then sometimes, the folks at the university system may or may not agree. Then they, and they feel like this, as I understand it, provides accountability for who they're actually bargaining with.
Okay.
Or whatever.
So we've already got a motion and a second, and we've clarified what the bill does in its present posture, so we're ready to vote. Maybe we ought to call the roll. Okay.
Senator Feldman. Senator Klaus-Meyer.
Yes.
Senator Benson.
Yes.
Senator Kramer.
Yes.
Senator Hayes.
Yes.
Senator Reedy.
No.
Senator Augustine.
Yes.
Senator Vital.
Yes.
Senator Hershey.
No.
Senator Jennings.
No.
Madam Chair.
Yes. Okay, so the motion carries.
The next bill is Senate Bill 35. This is a prevailing wage bill from Senator Feldman.
We are on the public.
So I'll describe, you have a reprint in front of you. There's some amendments offered from the sponsor. If you go to page, rather than saying what the bill does, I'll just go through the bill because the devil is in the details on prevailing wage and the definitions on who is in and who is out. So if you go to page 3 of the reprint, you'll see that the bill as introduced would have said any single dollar of state money that went to a construction project would have been subject to prevailing wage except for the schools. The schools were not touched. The current 25% requirement would still be left for the schools if the bill is introduced. As amended, the bill would put the rest of the state construction projects on the same level as the schools, and would be any Any public work project that gets 25% or more in state money would be subject to prevailing wage. If the entity that is part of the construction project comes up with 26% of the funds, then the project would not be subject to prevailing wage, at least a state prevailing wage. The bill also, if you go to the next page, would reduce the threshold for a public work to be subject to the prevailing wage from $500,000 to $250,000. So in essence, the bill is amended. Any public work that receives 25% or more in state funding at a value of $250,000 or more would be subject to the state prevailing wage law. And finally, if you go to the last page, and this was an amendment put on by by Economic Matters, which passed the bill similarly amended, and it would provide that the Act only applies to public work contract executed on or after the effective date of the Act. So it would not affect any existing prevailing or any existing public work project.
Okay. Do we have a motion, Senator
Yeah,
Belmont?
just before I make a motion, just real quickly, so the two thresholds, the current law of $500,000, just to be clear, I said this at the hearing, is the highest number threshold of any state in the United States. So when we go from 500 to 250, just to be clear, at the federal level, it's $2,000. Going to 250, I'm told that still puts us at like third or fourth highest in the country. So this 500 to 250, although dramatic, still puts us among the highest thresholds in the country. And then the other provision, as I say, to conform it with the bill that has already passed the House Economic Matters Committee, just aligns other contracts with what we currently do for schools. That's always been a little confusing. We have one set of rules for the schools and a completely set of rules for other public work projects. This simply removes any confusion. All the contracts, the projects are under the same threshold. And so that's basically what the bill does. And then again, it's prospective. The bill came out of ECM. And again, on that basis, I would move favorable, Madam Chair, on Senate Bill 35.
Okay, can we get a second? Second. Okay, Senator Klausmeyer seconded. All right, I see Senator Hershey and then Senator Reedy.
Thank you, Madam Chair. Can I just ask, when was it 50%? I see 50% is in the bill, but that's been crossed out. That's what the bill originally did, was drop that from 50 to 25 for just public works?
Well, the original bill was 50 to 0. In other words, many states have no such state dollar threshold, and so it went from 50 to 0, and the amendment sort of sticks it in the middle from 50 to 25%. So the bill, as it was introduced, went from 50, and it basically got rid of that.
If you got $1.
$1, right? That's the bill as introduced, but now we're the middle ground number of 25% aligns it with the schools, but it's. So I hope. I don't know if that,
yeah, because I think that's what we're seeing on the Eastern Shore, is that the counties, in order to avoid the extra cost that arises from this type of thing, they've actually tried to get to that 26 or 25%, 26%, so they wouldn't have to spend the additional cost.
Well,
of that.
in response to that, if you look at the fiscal note writer specifically says that, in fact, because I know we've had this conversation before about added costs due to prevailing wage, the fiscal note writer specifically says on page 7 and 8 that the data on that is actually quite inconclusive, that if prevailing wage applies, there are other savings, whether it's efficiencies or whatever. I'm just referring to the fiscal note. If you want me to specifically read that, but
no, it's a
but that aside, I hear you. Obviously,
Yeah,
I know philosophically
Right.
some folks here don't, believe much in the prevailing wage. But yes, this will bring more projects under that.
Okay.
Under
All right. I appreciate it. Thank you.
Can I get an understanding, because public works, we're talking about, is a road a public work? I mean, I guess county roads they pay for with their own money, although they may get some state funds. What's a public, just so I understand? I was trying to find.
If you go to subsection on the last page of the bill,
Yeah.
there is a definition of what is a public work, including, you'll see D, the subtitle applies to construction of a work including a bridge, building, ditch, road, alley.
Oh, got it. Okay, great. No, I'm sorry. I was looking for that. So it's basically a lot of infrastructure.
Yes. It's any infrastructure that's funded through the capital basic, well, I don't think it has to be even capital budget. Anything that receives a state dollar, any state project, anything that's 100% state funded is going to be prevailing wage.
Well, right. I knew that.
Yeah.
And anything 50 is, but now we're
Anything
saying
50 under
25.
current law that receives 50% or more in state funds would also be subject to the state prevailing wage law. The amendments offered by Senator Feldman would take it down to 25%, the same as schools.
Okay, so the same as schools. And so like even, we've been having the discussion on the floor about BRF. I mean, basically if a project's being funded and $2 million out of the Bay Restoration Fund goes to a project and that's 30% of the overall cost of the project, this would now fall under that, correct?
If it's a construction, if it's a public work,
If it's a
yes.
public work, would
Yes,
have to be
yes.
for, okay. Well, it doesn't have to be, that's right. Okay, all right, thank you.
Okay, Senator Hayes.
Hey, I'm sorry, David, at one point, and I may be getting this confused with something else, but was there a conversation at some point to include like bond bills? If it's 25%, would they apply as well?
Technically, if the bills introduced took it down to $1, in theory, every single bond bill would have been covered by this. By raising it to 25% with the $250,000, it's unclear how many bond bills would be subject to this, but many, a good portion of them would not be subject because they're small enough that they would either fall under the $250,000 threshold, or the state would be contributing less than 25% of the cost of the project. Or did I get that right? Anyway, the state would not be contributing more than 25% of the cost of the project. So we don't have an actual number on how many bond bills would fall out because of this amendment, but it's going to be less, and a lot of the smaller projects would not fall under prevailing wage.
You said it'll be less because you're decreasing the threshold?
Yes, because you increase the percentage of the state requirement, and there's still the $250,000 threshold. Some of the smaller bond bill projects would not be covered, and many of them are small. I guess they're called legislative initiatives now.
Legislative bond initiatives.
Yes, bond initiatives.
But you said you're lowering it. I thought it was at 50%. You said it's less.
The bill as introduced would have covered
50.
every single one because it would have been $1 of state money.
Got you.
With the amendments offered by the sponsor, it takes it up to 25%. So a lot of these smaller bond projects will probably drop out.
I got you. So current law is 50%, but the way it was introduced, I see what you're saying. Okay. All right.
Okay, are we ready to vote? Okay, why don't we call the roll?
Senator Feldman,
Aye.
Senator Klausmeier,
Yes.
Senator Benson,
Yes.
Senator Kramer,
Yes.
Senator Hayes,
Absolutely.
Senator Reedy,
No,
Senator Augustine,
Yes.
Senator Vital,
Yes.
Senator Hershey,
No.
Senator Jennings,
No.
Madam Chair.
Yes. Okay. Okay, we're ready to go to Senate Bill 444.
Remember Nathan talked to you about that
Yeah, I talked to him about this. It was the cemetery one I told him.
Okay. So Senate Bill 444 is back. It was held last week over some concerns that were raised about the entity that would be staffing the group. There has not been any progress on that issue. So currently, the chair is offering an amendment that changes the staffing entity to the Department of Commerce in line with the bill that passed the House. And Commerce has responded saying that there would be a significant cost. And that's where we are.
Move favorable on the amendment.
Second.
Okay, are we? If there's no discussion, yes, Senator Glassman.
I would like to say, if you want to hold it, it's up to you, but I will get an answer from Senator West and the appropriate parties, and we will be able to vote on it tomorrow. Okay?
Okay, that's
I
fine.
mean, they have been throwing all kinds of different ideas around, and,
But
so I'll take care of it
what
today.
I thought was what passed in the House.
The House moved the bill with an amendment that tasked the Department of Commerce with staffing the work group. After they moved the bill with that amendment, Commerce reached out to members of this committee and raised concerns about the cost and provided a number over $700,000.
Okay, Senator Hayes, I see your line.
Nate, I thought. Hey, excuse me, Nate. I thought in the hearing, wasn't it brought up that there's already a joint committee, and what role would they play in this? Like, there's already the joint committee on cybersecurity, information technology, and biotechnology of both the House and the Senate. Wouldn't this come under that purview already?
For purposes of staffing?
No, just as, there's already an established group that's considering issues as it relates to emerging technology and stuff like that.
And so
I
to
know
the
the
extent,
composition of this is a little bit different. Is that the value added, and that the composition differs from the joint committee?
so the composition is different, and there are two reporting requirements that take place over the course of 2 years, and so there are actual deliverables that, and so if you recall the discussion, if what you're driving towards is, doesn't the Department of Legislative Services already have a
Right.
connection to these issues?
Yeah.
The concern that was raised by DLS management after the House made the change to the Commerce Department and looking more closely at the bill is that the department does not have the expertise, despite, I understand what you're saying, that there are things that touch on the same subjects, but it's felt that the deliverables and then also just the range and sort of granular knowledge that would be required is such that it would be a significant burden on the Department of Legislative Services, and that they may in fact also need to procure outside assistance.
Got you. And so this bill that we have in front of, well, I thought I had in front of me, I don't really. But we're conforming to what the House is saying, that the Department of Commerce would staff it as opposed to the Department?
That's correct.
Ooh, okay.
Okay, Senator Vidal and then Senator Augustine.
Thank you, Madam Chair. So I had an email on March 4th that I thought I forwarded to Nathan, that Senator West sent, saying that the Regional Manufacturing Institute would staff the work group, has the expertise and willing to undertake this task at no cost to the state. Did that not happen?
So I confirmed with the sponsor's office this morning that he is not offering an amendment related to the staffing of the group.
Thank you.
Yeah.
Okay. All right, Senator Augustine?
Thank you. So if we presume that this is the cost, has Budget and Tax looked at this? I mean, I wouldn't want us to get on the floor and then that come up. Have they looked at it?
No.
Okay, Senator
Get some
Klossmeyer.
more information for tomorrow, and I'll have some answers for everybody.
Okay.
Okay, we'll try to get an amendment from them, and at that point, if not, then they're on their own.
Okay, we'll wait for the information that she's seeking tomorrow. Okay. And we'll just defer this to them. All right, so we'll move on down to 719.
Senate Bill 719 requires the
Excuse me, guys. Not only do we keep the public confused about which bill we're on when we don't have decorum, but it's difficult, and not because we are muzzled with our masks, to hear each other. So we could talk one at a time and when we're recognized. Thank you.
So Senate Bill 719 requires the Maryland Department of Health to make recommendations to 211 Maryland regarding the establishment of an opt-in mental health services phone call program that requires a call center to make periodic calls to persons who have opted into the program and attempts to connect persons with a mental health provider upon request. There are some amendments that have been offered. The first is by the sponsor of the bill that would authorize the governor to include in the annual budget bill an appropriation to the department in an amount sufficient to carry out the bill. The second amendment would alter the effective date to July 1st instead of October 1st. And then Senator Augustine is offering an amendment that would change the title of the bill so that it would say the Thomas Bloom Raskin Act.
Our Congressman Raskin, who was vice chair of JPR, and he did a great job in Congress for us, trying to help us through with the pandemic stuff. Right after his son died, within a week. So I think that was the idea, that he's still serving us and under great terrible circumstances. Okay.
I could just even little more clarity on that. With Senator Zucker, he was inspired actually by the situation that occurred with Congressman Raskin's son passing, and that's what really made him think about this connection between, suicide and 211 and the senior call check program, and so he just thought it'd be appropriate to, put it in the name of the congressman's son.
Okay, and Senator Feldman?
Yeah, I was just going to also add that I understand that either Senator Augustine or Senator Zucker both reached out to the family, to the congressman, and, we don't want to do this without consulting him, and the family is, as I understand, tickled pink by it. So
And the young man's mother, Sarah Bloom Raskin, used to be our Commissioner of Financial Regulations for the state of Maryland, too. Yeah. She used to testify in here a lot.
Madam Chair,
Yeah.
favorable on the bill as amended.
The second.
We just need to get a second if there's going to be one, and then we can.
I think people want to be on the bill.
Okay. All right. Did somebody second? Yes. All right. JB seconded. All right. Now, people who want to be on the bill, I don't think I'm on it. Everybody wants. Is that unanimous? But we all like to be on the bill. All right. Put the whole committee on. All right. And in light of that, if you're in favor of the bill, would you just raise your hand? Okay. Thank you. Everybody's on it.
Senate Bill 729. This is the bill that requires the health benefit exchange in consultation with the insurance commissioner and as approved by the exchange board to establish and implement a state-based young adult health insurance subsidies program. In fiscal 2022 through 2024, funds must be designated for this program, and just walk through some amendments that Senator Feldman is offering. The first is just a corrective amendment so that this is on page 5 of 6 of the reprint, so that the income range for eligibility for the program aligns with the eligibility percentages that for which you can get advanced premium tax credits through exchange coverage. So it would be 133% and 400% instead of 140. And then the second amendment is on page 6, and that this says that subject to available funds in each of fiscal years 2022 through 2024, instead of the governor being required to, the exchange may designate funds from the MHBE fund to be used for the pilot program, so that up to, or not more than 20 million in annual subsidies may be provided to young adults who meet the subsidy eligibility and payment parameters under the program.
Okay, Senator Feldman.
So just, again, refresh memory here. So this bill had no opposition at the committee hearing, has, already passed HGO, and is the branch, it was the result of actuarial study and a work group at the exchange. They're the ones that came with this idea, borrowing best practices from a number of other states to really try to get more young, healthy people into the risk pool, which also has the double benefit of helping stabilize the individual market. And it's a pilot project, very targeted for just 2 years. And this amendment, I think, gives now more flexibility. The bill, as introduced, had a specific dollar figure. Now it's up to, so I think that gives, is sort of in response to some of the concerns that, you're taking some money from the reinsurance. Again, there's no new money involved here. This is the existing reinsurance fund. So this, I think, new language gives flexibility to the exchange to make sure they thread the needle in this pilot project. And obviously, it's a pilot project, so for 2 years. So anyway, with that, I would move the amendments, Madam Chair.
I'll second it. Okay. Yeah. All right. Are we ready to vote? Okay. Just raise our hands unless we've got some contention here. Okay. Thank you. It is a very good bill. And Senator Feldman, is co-chair of the commission that we have that is overseeing all of this work.
The next bill on your list is Senate Bill 741. I think this is a bill that we heard 2 weeks ago. This is the COVID-19 Testing, Contact Tracing, and Vaccination Act of 2021. This is an emergency bill that requires the Maryland Department of Health, in collaboration with local health departments, to adopt a 2-year plan to respond to COVID-19. The plan has to include certain measures and establish a Maryland Public Health Job Corps. The health department also has to develop and submit a comprehensive plan for vaccinating residents against COVID-19 and convene a public health infrastructure modernization work group. The bill requires the health department to provide certain funding to local jurisdictions, assisted living facilities, home health agencies, and nursing homes. And then there are requirements relating to testing in the bill on assisted living facilities, home health agencies, nursing homes, institutions of higher education, and some coverage requirements on health insurers. So I'll walk through a reprint. Had a couple work sessions on the bill. So first, on page 3 of the reprint, this is about a third of the way down. This is the section of the bill that relates to the 2-year COVID response plan. The definition for a COVID test has been changed to align with the one that's used in the Federal CARES Act. The amendment would require the department to adopt and implement this 2-year response plan by May 1st instead of April 1st. I'm pushing that back a month. The plan requires certain things relating to testing, such as measures to enhance public health efforts at the state and local level to monitor, prevent, and mitigate the spread of COVID-19, and to assess the public and private testing infrastructure in place, both statewide and in each local jurisdiction. There are some additional elements relating to testing that are listed here in the bill. One of the requirements is for the plan to establish specific monthly goals for COVID-19 testing statewide and in each local jurisdiction to ensure access for all residents of the state. The bill, as drafted, originally had set a goal to achieve the capacity to perform up to 100,000 COVID-19 tests per day. The amendment would strike that specific numeric requirement so that the goal is to have the capacity to perform the surveillance testing required to safely reopen and keep open schools, institutions of higher education, workplaces, and other community facilities in the state, while minimizing the community spread of COVID-19 in calendar years 2021 and 2022. That's a question. Senator Reedy?
Yeah, if it's okay for you to call me.
Senator Reedy.
Yeah, thank you. I just, as we go line by line, I wanted to, the amendment makes this a little better because the 100,000 was kind of like a number, whereas we want to not do that and put that into law. The surveillance testing required to safely reopen and keep open schools, this is a 2-year plan. Are we saying we're going to have surveillance testing sites set up for the next 2 years if we pass this bill? Are we saying that they need to have a plan to have them all set up for the next 2 years?
So the goal, the requirement is to have a plan that covers the next 2 years, that includes a capacity to have surveillance testing for these things to take place, for schools to reopen and to stay open, as well as for institutions of higher education, workplaces, and other community facilities.
Okay, as we keep going, I guess my question, I've been concerned about this bill just because we're putting in place things for 2 years, like we're going to be February of 2021 for the next 2 years. And I'm just a little concerned about that. It's also a very big price tag on this. So, I mean, I assume the amendments adjust the pricing some, but it's a mandated expenditure on top of other mandated expenditures. Okay. Thank you.
Yeah, and I'll note as an initial comment about the mandatory appropriations. First, the Budget and Taxation Committee is second on the bill, so they'll have an opportunity to look at this. And then second, the bill is drafted, and we'll see this in the language, would require the use of federal funding for these grants and required appropriations first. And then if the need exceeds what is available through the federal funding, then the general funds would kick in. Just at the very bottom of page 3, we get to the local jurisdictions and the goals on local jurisdictions. There was a requirement here that would require establishment of at least 6 public or private testing locations to achieve that surveillance testing goal. Language has been struck there that just says the required number of testing locations. What's also been struck here is there was a requirement that local jurisdictions would have to bill carriers to cover the cost of insurance, the cost of testing. This has been struck. Added is a requirement on is to include an estimate of the funding required to implement the surveillance testing goal and the extent to which federal funding already received by the state in fiscal 2021 and federal funding that's provided to the state received after March 1st of this year can be used to cover the cost to cover the cost required to achieve that surveillance testing goal. Moving into a next section of the bill, this is the part of the plan that governs contact tracing. I can stop there. Senator Kramer, do you have a question?
It may get addressed. I was just curious. Do the amendments, because of the way they've changed the local responsibilities, addressed what the fiscal note reports with regard to local expenditures? And that those local expenditures would increase by at least $15 million. And Prince George's reports, according to the fiscal note, that their costs would increase by $10 million. Is that, do the amendments address that?
I don't know. I don't think the amendments directly address that. What the amendments do is strike some of the very specific numeric goals but still, these elements that have to be required in the plan remain.
So the cost to the locals would remain?
Yes,
The
but there are
financial impact?
But there are some mandatory appropriations in the bill to give the locals what they need to carry out the testing and contact tracing requirements of the bill.
Are those based on the assumption that those federal funds that the bill makes reference to will be there?
Yes.
Okay, so
That's
it's
right.
on that basis.
On that basis.
And what if those federal funds aren't?
So I can speak to, I reached out to some of our budget analysts about this, and I will say that the sponsor of the bill has been working with folks within our department who deal with the budget. And some figures that were communicated to me is that they're expecting to get between $800 million from this new round of funding that's going to come from the Biden stimulus plan that just passed. So there's expectation that there will be a lot of federal money coming for vaccinations, for testing, and for contact tracing. And this is actually on top of $220 million in FEMA money, plus an additional $50 million that came in from the December stimulus that's been included in supplemental budgets. So, the feedback that I've been able to gather through just inquiring about some of this is that there seems to be a lot of federal money that's going to be coming to the state.
Okay, thank you.
On page 4 for the requirements in the plan relating to contact tracing, the plan has to assess the contact tracing infrastructure in place for COVID-19 both statewide and in each local jurisdiction, and to determine the optimal number of tracing, case management, care resource coordination, and other personnel per 100,000 residents needed to effectively prevent and mitigate the spread of COVID-19. Also, just requirements that the plan identify and address unmet needs for contact tracing, establish goals for identifying, locating, and testing individuals who've been in contact with people who've tested positive that align with CDC guidance, and include a mechanism for monitoring performance of contact tracing and testing, both statewide and in each local jurisdiction. The department has to assist local jurisdictions to adopt strategies they have to assist local jurisdictions that adopt strategies to accelerate access to and the use of at-home collection and point-of-care tests, and that elect to incentivize and encourage pharmacies and healthcare providers to provide COVID-19 testing. There's language here that requires that the plan allow each local jurisdiction to establish their own contact tracing program if they so choose. This next part of the bill relates to the Maryland Public Health Job Corps. The department, in collaboration with local health departments, healthcare providers, representatives of area health education centers, and other relevant stakeholders, have to include in the plan required the establishment of this Public Health Job Corps, which would be composed of community health workers and other healthcare personnel recruited, trained, and deployed for employment by local health departments, nonprofits, and other entities to respond to the outbreak by providing, and the amendment here is to the extent authorized under state or federal law, so that it's clear that they would be having to operate within their scope of practice when doing functions like that. These folks would be doing testing, contact tracing, vaccine administration, including outreach and navigation supports, other case management and resource support services. This program has to have a design that prioritizes recruitment, training, and deployment of individuals for the workforce who've been displaced from other workforce sectors and have negatively been impacted from the outbreak of COVID. They've been displaced because of the negative. And they've been displaced from workforce sectors that have been impacted negatively as a result of the outbreak of COVID-19. And this program has to include a pathway to enable members of this workforce to transition to positions with the responsibility to meet ongoing post-pandemic health needs of underserved communities and vulnerable populations. Senator Reedy, did you want to ask a question?
Yeah, so we're establishing, I guess when I first looked at this, I wasn't sure, but how does the Health Jobs Corps, this is establishing a Maryland Public Health Job Corps?
Yes, it would require it would require in the plan that this job corps be established.
How is that different from some of the efforts that we had during the pandemic here to recruit more people into the healthcare workforce? Those are obviously not state employees, I guess we recruited, correct? That was a recruitment effort?
So I think over the summer there was a program that the governor established to try to recruit clinical personnel to address some of the shortages of clinicians, in hospitals and other locations.
That's what I'm remembering.
This is a little different. These are non-clinical personnel who would be able to perform some of these public health functions that are non-clinical in nature, but are needed.
My concern here is that this is very prescriptive. A lot of this is very prescriptive. If there is an outbreak after we have the vaccinations, hopefully by May we're going to start getting a ton more vaccine here. And some of the things in the bill about making sure there's resources available to vaccinate more citizens, I'm fine with that. But it's like we're setting up a whole bunch of things because the next 2 years are not going to be like the last 6 months, thank God.
We don't know.
Well, we hope, but we don't want to set up some permanent structure. This looks like to me they want to do what the National Guard can do, doesn't it? Am I wrong in saying that what this Job Corps would do would be a lot of the things we're talking about is the same thing as the National Guard would do in an emergency?
I think the scope of, just to go back to the types of functions they'd be performing. It could be some testing support functions, like over across the street, we have people who are guiding people in to sign up and, and all those.
Where do those people come from now?
Non-clinical functions.
From the health department in Anne Arundel County.
Right. And contact tracing, these people would be available to do the phone calling and the outreach to individuals to check up on folks who might be quarantining or have resource needs. Vaccine navigation for hard-to-reach populations. There's some thought that you're going to need to have a workforce of people who are going to be doing outreach.
That part makes sense. Yeah.
Following up, so that if they're still needing to get the second shot, they have the support to do that, et cetera, stuff like that.
You understand?
The other thing is that you don't know how long we're going to be in trouble considering all these variants, and we don't know how long the vaccines we've just gotten last. If you got to get them every year the way we do for flu.
It's true, but I don't know, do we want to be in a situation where we're putting in place for 2 years a surveillance testing scheme and contact tracing scheme based on what we have right now? I just feel like you're telling me, I don't want to get into debating the bill, but the Department of Health, we're being very prescriptive in this bill is all I'm saying. Very, very prescriptive and very expensively prescriptive. We're not health professionals. None of us in this room are. None of us are public health professionals. And the sponsor of the bill, who's very well-intentioned and very knowledgeable, is not a health professional. So, I'll leave it at that.
Senator Augustine?
Madam Chair, hearing these questions, this bill does not come to district. There's been no coordination at the state.
Mm-hmm.
We need this. If there were a good COVID-19 testing plan, contact tracing, and vaccination plan in place by the state of Maryland, we wouldn't have to do this. So that's the reason why. And I've talked to the sponsor about this. We've reached out to the department, and they have not really participated. And therefore, we can't not do anything with how poorly this has gone. And so that's what this is about. And the reason I can understand, Senator, why you're feeling that way, but But this is why. This is the reason why. This is the purpose of the bill. And so I just felt like it's important for us to put it in the context of the circumstances that we've gone through over the last year of this.
Okay.
So
All
I'll
right,
just,
if there are no more questions,
I'll just proceed if that's okay.
okay.
We're on page 6 of the reprint. This is the, there was some amendment language that's being offered, and this is language that would require the plan to have a design that addresses the disproportionate impact of the pandemic on underserved and minority communities in the state. The department would be required to submit this plan to the General Assembly by May 1st. In subsection F here, we're still on page 6. This is the section of the bill that requires provision of grants to local jurisdictions for testing and contact tracing. So this is for fiscal years 2021 and 2022. $25 million each year in grants to local jurisdictions for expanding capacity for testing and contact tracing. This has to be divided between the local jurisdictions in proportion to their respective populations, and the funding must supplement the grant funding. The department has to supplement the grant funding that's required here if it determines that the initial allocation is not sufficient to meet the testing and contact tracing needs of the jurisdiction.
I'm thinking this with the questions that are being raised. Why don't we hold this one today, Patrick, and we'll check more about where the funding is going to come from.
Okay.
Can I just one question on this?
Yeah.
So I got a call from the independent colleges and universities, and they had problems with it. Have we addressed their concerns?
Yes, later on in the bill, there are requirements regarding testing, a testing plan, and amendments have been proposed here that address their concerns.
Community colleges too, they had something in here. Did they get that? Okay.
Yes,
I was looking for it, I didn't see
that's
it. Okay.
correct.
That's fine.
I know the chair's asked to hold it, and one of the things to just keep in mind is beyond the funding source here, I think that there's an attempt to figure out what the federal package, what that could mean here. So before we jump on, I think that's another reason we want to hold. We were trying to assess how the federal package may play into the funding source for this, and rather than jump too quickly here, I think this is an appropriate hold.
Because if there are federal funds to do some of this, we don't want to
Correct.
use up our state funds. Okay.
I would ask is that we do let Patrick go through so everybody can
Yeah,
understand.
no, yeah, I apologize.
what
Yeah, no,
he's-
I wasn't my attempt to, yeah, I agree. Yes.
Yeah, go
Okay.
ahead.
Oh, so I'll complete this. So let me just continue to page 7. This is where there are grants to local jurisdictions required grants to local jurisdictions for vaccinating residents. If you go a little bit further down, there are required grants to assisted living, a requirement for grants to assisted living programs and home health agencies to cover the cost of testing. On page,
I will say one button and say one thing. Those very large assisted livings that are part of continuing care communities are not going to be the ones in trouble. It's those independents that are 25 or less. Some of them are down to where it's 2 people in someone's home, and there's 1,600 of them. They're in all our counties. We got no infrastructure in place, and there aren't any state employees or anybody to do anything about it. They are never visited. Okay, so that's something else we got to look at before we take it to the floor.
just on page 8, this is where there's a requirement for the department to establish the vaccination plan. This plan, as the amendments under the amendments proposed, would need to be submitted by May 1st, and the plan would need to include the categories of residents who will receive priority access to vaccines, the timeline for providing vaccines in each of these categories, and members of the general public, target metrics for vaccinating residents, a dedication of time and resources to target vaccine distribution and vaccine safety outreach efforts to communities that have been disproportionately impacted by COVID-19. An amendment here would require a vaccination distribution strategy that allocates resources and vaccines across all partners and vaccination sites in an equitable manner that ensures that the allocation by jurisdiction accounts for the disproportionate impact of COVID-19 on underserved and minority communities. This amendment would say, if possible, the plan would need to include the development of a single portal for residents to sign up and receive a vaccine, and if this is not possible, an explanation for why this is not possible. The department would need to provide weekly progress reports to the General Assembly. On page 9, this is where the Public Health Infrastructure Modernization Work Group is established. Here you see the membership of the work group. Its task is to assess the current public health infrastructure resources in the state and to make recommendations for how to establish a modern and effective public health system with the capacity to monitor, prevent, and control, mitigate the spread of infectious disease. And this amendment would expand the scope so they would also be making recommendations as to how to achieve state health improvement process goals. This report of this group would be submitted to the General Assembly by December 1st. Starting on the bottom of page 9, we're getting into some of the requirements relating to testing. The first is on institutions of higher education. To get to the questions that were raised, the amendment here would say that for calendar year 2021, an institution of higher education that has residence halls for students, so vast majority of community colleges would not be subject to the requirements here, that these institutions of higher education would establish a COVID-19 security plan that includes both screening and testing procedures that will keep students, faculty, and staff safe while on campus for face-to-face instruction during the pandemic. And then this security plan would need to be posted on the website of the institution of higher ed and made available to the public. Just below here on page 10, this is where there's required funding for nursing homes to help cover the cost of testing. On page 11, this is where we have requirements on home health agencies. Amendments here are fine with them, but this would require for calendar 21 and 2022 a home health agency to adopt and implement an infection control and prevention plan for patients and staff, provide these services to patients of the agency. And this plan would have to be adopted and implemented in accordance with applicable federal orders and guidance, and ensure that patients and staff who provide the home health care services to patients are screened on a regular basis and tested or referred for testing for COVID-19 if required or recommended under applicable federal orders or guidance to control and prevent the spread. This information, this plan would need to be, if we go to page 13, would need to be provided to patients and staff and other members of the public upon request. So on page 13, we have testing requirements for nursing homes. They have to adopt a testing plan that's guided by applicable federal orders and policies and that are reasonably related to testing positivity rates in the local jurisdiction where the nursing home is located. On page 14,
they've got so many testing requirements already. Are these to be superimposed on the?
I think the testing requirements that they're currently under align with what would be required here. They currently are under requirements that have a connection to the positivity rate in the local jurisdiction. So they're, yes.
Maybe we need to change the verb, though, so it shows progression, that it's something existing that's continuing, because it sounds all new. Yeah.
Yeah. So regarding the testing requirements on nursing homes and assisted living facilities, they haven't raised any concerns about the language here.
They don't. They're busy doing what they're doing. They're not looking at it.
So on page 14, we have the testing requirements for assisted living programs, which are the same. They mirror those for nursing homes. And then on the bottom of page 14, we have insurance coverage requirements. This is the bill that, part of the bill that deals with insurance carriers' requirements for covering testing. The bill is introduced, had a pretty expansive coverage requirements so that they'd have to cover tests when done for surveillance purposes. But the bill has been amended with input from MIA that would narrow the coverage requirements so that the carriers have to provide care practitioner fees in the evaluation of the member for purposes of determining the need for a test, as required by federal law, the Families First Coronavirus Response Act, the CARES Act, and applicable federal regulations or guidance. This gives them the ability to enforce current coverage requirements on carriers that the federal government has put in place.
Okay. Let me butt in and just say one other thing. For nursing homes, the people who are the permanent residents there are fairly well off, and Medicare is involved for limited things up to 90 days. For, again, any assisted living people that might be in there, they on Medicaid, and they don't get, we got to look at who's paying. And that's my concern with the care, these care people who come in and out of private homes. You're not talking about Medicare. You're just talking about Medicaid. The more I'm thinking about it, I'm using people like that right now. And some of this would price people right out of the ability to have assistance at all.
Yes, I mean, I think if the question is who's been covering the cost of testing in nursing homes, the nursing homes have been covering the cost to do the surveillance testing, the testing on a weekly basis, and you know the state has given them some money to cover the cost, but they've had to absorb the cost as well. The way that
nursing homes, I understand. I'm talking about the assisted livings and these private care folks that come in and out of other people's homes. You're going to price people right out of being able to have service.
That's by, we worked with the nursing home, the home health care folks, and they do it by surveillance. They've had very good luck. They haven't been having cases of exposure. So that sort of like we do when we answer the questions about have we had a fever, do we have a cough? So they've been handling their staff and their patients by surveillance.
My husband is under one of them. While I'm here, I'm spending a fortune, and I'm just, on that kind of care.
Yeah,
so
so
they come into your homes. Yeah, I'm just
yeah,
saying.
they're not actually being required to do testing, but they need to have a program that shows that they are checking their employees and making sure that they're not having exposures or showing signs of COVID.
Find them all. There's thousands of them, and it's those. They're very small. They're scattered all over the place. I don't even know how you would find them all. Yes, Senator Jennings.
Thank you. I just have a question about a term used I haven't heard through the pandemic. Page 13, line 13. COVID test means an in vitro diagnostic test. I haven't heard of that type of test. Is it new?
So that's any type of, I think in vitro refers to a test that involves the collection of any type of bodily, fluid, and so it would include. It's an expansive term that's used for the definition of a COVID test in the federal law. So a swab of saliva, nose, right. I think the last thing I'll just note for the insurance coverage, there is a requirement here that the coverage for COVID testing be provided without cost sharing, no copay, no co-insurance requirement or deductible, which is currently the requirement under federal law.
Okay.
And these requirements relating to testing on nursing homes, assisted living, higher ed, insurance coverage, that this part of the bill is a sunset, so it's for 2 years.
Okay.
Sunsets at the end of December 31st, 2022.
Patrick, have we been talking with Dana Kaufman or with Joe D'Amato?
Yeah, they were participants in the work group, yes.
Okay.
Madam Chair, I'll just renew our, I think, hold of this for,
Yeah.
until we can, yeah.
Madam Chair, if I can just remind us that this still needs to go to budget and tax. So if we hold it, can it be just till tomorrow so that we can get it over to budget and tax?
Okay. Okay. Anything else on this one, guys? Any more guidance? Okay.
We have one more bill on the voting list for today. It's Senate Bill 796. This is the bill that expands the Healthcare Disparities Policy Report Card published by the Office of Minority Health and Health Disparities, so that it includes racial and ethnic composition of the individuals who hold a license or certificate issued by Health Occupations Board, rather than it is now, which is just for the physician population.
We are doing a new bill, guys. Go ahead.
The report card also has to compare racial and ethnic variations in insurance coverage for low-income, non-elderly individuals and the racial and ethnic composition of individuals licensed or certified by Health Occupations Board with the previously published report cards, including the same information.
Move favorable.
Can we get a second?
Second.
All right, it's been moved and seconded. Has everybody been listening? Okay, all right. You want to just raise your right hand if you're in favor of this bill? Okay, that seems to be unanimous. Thank you.
Two withdrawn bills.
All right.
We're going to move unfavorable on the two withdrawn bills.
Okay,
Those aren't-
let's just
that's a
vote.
West
Raise
bill.
your hand if you're in favor of the motion. Okay. Okay, that carries. All right. All right.
So we're going to end it.
All right, we are ending this voting session.